Good morning, everybody. Welcome to our quarterly awards and recognition ceremony. We're here to recognize our team of dedicated employees for their contributions to serving our nation's heroes. My name is Ruth Hatchell, and I'm the Veteran Experience Program Manager in the Employee Patient Experience Service. Our department is designed to enhance our employees and veteran experience and to ensure we continue providing world-class care to our veterans throughout Northeast Ohio. I would first like to welcome our new Chief of Staff, Dr. David Massaro. Welcome to the VA Northeast Ohio Healthcare System. We're so pleased that you've come to join us with our outstanding team here at the VA. I also would like to welcome all of our service chiefs, managers, supervisors, and anybody else that has come to support our awardees today. The executive leaders are here to honor you as well. And we would like all of you to recognize each and every one of our employees for everything that they have done to serve our nation's heroes. Following the ceremony at the back of the hall, we have a reception, and we hope that you will all stay and enjoy that reception. Our acting executive director, Timothy Hyman, will be providing us with opening remarks. Welcome, Tim.
Well, good morning, everyone. Welcome to our Q2 annual awards ceremony. You can't tell in here, but it's a beautiful spring day outside. I'm sure that will not last very long for the couple days in Ohio, but it's a wonderful way for us to celebrate everything that we do. A small group of folks are going to be recognized today. You all know, as service chiefs and leaders in the room here, helping to recognize that we do fantastic things in all of our buildings, many more than what we're going to have here. So, we really look forward to these ceremonies and trying to recognize folks as best we can, but know that we're missing a lot of that recognition for everything you do every day. So hopefully, ELT is out and about. We are doing our rounds, and we're able to see and recognize you in other capacities as well. But with that, let's give some awards away.
Thank you, Dr. Hyman. Good morning. My name is Catherine Bird. I'm an education instructor in the Employee Patient Experience Service. I would like to welcome you all here today, especially our awardees. This is a proud moment for you and an exciting moment for us. It is my honor and pleasure to be your mistress of ceremonies today. We will now begin presenting our first awards, starting with the Length of Service Award. VA Northeast Ohio Healthcare System appreciates its employees. Employees make VA not just a job, but a career. It is essential that the VA has experienced and knowledgeable employees to support the mission of the VA. VA Northeast Ohio Healthcare System acknowledges employees with service awards based upon the years of service that an employee has worked at the VA to demonstrate its appreciation for these employees. I am privileged to call up these employees to receive their Length of Service Awards. Please hold your applause until an employee in the service group listed have been announced. Ms. Andy Pacina, please join Dr. Hyman at the podium to honor these awardees from Facilities Management, HHS Director's Office, Patient Care Administrative Services, Police and Prosthetics, and Sensory Aids. 35 years, Gail McGowan, Director's Office. 25 years, Timothy Robertson, Police Services. 20 years, Sean Arnold, Facilities Management. 10 Roberts, Facilities Management. 10 Justin Ricker, Police Services. 10 Justin Taft, Police Services. 10 Please welcome our Chief of Staff, Dr. David Massaro. Please join us at the podium to honor these awardees from anesthesia, dental, mental health, radiology, primary care, social work, and surgery. 30 years, Jodelle Howard, primary care. 25 years, Linda Bond, mental health. Ellen Budarak, social work. LaDonna Glessinger, social work. Karen Miller, radiology. "20 years, Michelle Burns, radiology. Julie Gee, anesthesia. Stephen A. Miller, mental health. Centere Perry, dental. Michelle Tremblay, radiology." Thank you, Dr. Massaro. Absolutely. Ms. Katina Stone-Jones, Associate Director, please join us at the podium to honor these awardees from Logistics, Nutrition and Food, Patient Care Administration Service, and Safety and Emergency Management. 45 years, Daniel Mashek, Safety and Emergency Management. "40 years, Kazi Woods, Surgical Care. 30 years, Jose Serrano, Logistics. 20 years, Sharon Hobbs, Nutrition and Food. Alice Madden, Nutrition and Food. Katrina Nash, Health Administration. Sheena Pollard, Health Administration. Regina Smiley, Nutrition and Food. Tanika Watson, Health Administration. Darlene Walker, Nutrition and Food. Thank you, Ms. Stone-Jones. Dr. Tim Hyman, Chief of Pharmacy and Community Outpatient Services, will honor these awardees from the VA clinics, community care, and pharmacy. 40 years, Pamela Douglas, Community Care. 35 years, Karen Bolden, Community Care. Christine Stika, Pharmacy. Norma Jean Thomas, Community Care. 30 years, Tara May, Community Care. 25 years, Shauna Caskey, Community Care. Sherry Pean, Community Care. Anita Poyer, Community Care. 20 years, Christine Garcia, Community Care. Stacy Hirth, Community Care. Oh, sorry. Okay, no problem. Norma, yes. Norma Jean Thomas, Community Care. 35 years, okay. Sean, okay. Shauna Caskey, Community Care. Sherry Pean, Community Care. Anita Poyer, Community Care. "20 years, Christine Garcia, Community Care. Stacy Hirth, Community Care. David McCluskey, Community Care. Ashley Shemshali, Community Care. Thank you, Dr. Hyman. Mr. Robert Jastrom, Associate Director, please join us at the podium to honor these awardees from Environmental Management Services and Police and Security Services. 25 years, Mitchell Caldwell, Environmental Services. Robert Crew, Environmental Services. "20 years, Gregory Anderson, Environmental Services. Wallace Hambrick, Environmental Services. Ms. Kristen Guadalupe, Associate Director, please join us at the podium to honor these awardees from Quality and Patient Safety. 25 years, Timothy Gaffney, Quality and Patient Safety. Thank you, Ms. Guadalupe. Mr. Garrett Schreier, Associate Director, Patient Care Services. Please join us at the podium to honor these awardees from Nursing. 30 years, Paula Ann Sheridan. 25 years, Donald Anthony Jr. Daisy Carter. 20 years, Shireen Leffridge. Allison Messiria. Oh, Shireen, my apologies. Shireen. Okay, Shireen is here. Shireen is here. Allison Messiria, Tracy Richmond, Paul Snonikin, Julie Voiles. Let's give our Length of Service awardees a round of applause. Let's congratulate the award recipients of the following awards: Daisy Nurse Leader and Sunshine Awards, Great Catch Awards, Hero Awards, Employee of the Month Awards, and IARE Project Awards. Mr. Garrett Schreier will honor the Daisy and Daisy Nurse Leader recipients. The Daisy Award. The Daisy Award is an international award that recognizes the superhuman work nurses do for patients and families every day. This award gives staff, patients, and families a way to express their gratitude for the compassionate environment nurses provide. Their exceptional and compassionate care is demonstrated by the VA's core values of integrity, commitment, advocacy, respect, and excellence. All VA Northeast Ohio Healthcare System RNs and LPNs are eligible for this award. Mr. Schreier will speak to the next two awards.
Good morning. All right, Daisy Award. James Roth is a fantastic nurse and a great person. He exemplifies everything the Daisy Award symbolizes. James serves veterans with enthusiasm and cheerfulness. He is always personable and goes above and beyond to meet their needs. He is always the first nurse to assist another nurse, seeking out opportunities to be helpful. James is also a great resource. I know if I ask him for anything, he will help or will figure out the answers. James' quick actions and her heroism, saved my life. And this was put in by a colleague, mind you. His quick actions saved my life. Last week, I was swallowing a pill and began to choke. I legitimately could not talk or breathe as the pill was stuck in my airway. He immediately started the Heimlich maneuver on me and was able to get it up. I will be forever grateful to him. His actions were selfless and adept, but he is very humble about it. Please congratulate Daisy Award recipient for quarter 2, James Roth, RN from the Same Day Center.
Next, we will recognize the Daisy Leader Award. The Daisy Nurse Leader Award was created to recognize nurse leaders who fully support their direct care staff as they deeply appreciate and respect the care that staff nurses provide. These leaders also understand the value of celebrating the impact staff have on patients and their families through ongoing meaningful recognition. As the healthcare landscape becomes more complex, with increasing demands on nurse leaders, we believe that those who create an environment of compassion and recognition for others strongly deserve to be recognized themselves. With recognition, they may be held up as models of outstanding nursing leadership. Despite working under tremendous pressure, through their leadership, these nurse leaders provide a haven of safety for staff, both physically and emotionally. In this environment, nurses are inspired to do their very best by nurse leaders who role model caring behaviors. These leaders provide a setting where compassion is valued and staff, in turn, treat patients and their families with deep humanity. This Nurse Leader Award gives staff, patients, and families a way to express their gratitude for the compassionate leadership. Their exceptional compassionate leadership and care is demonstrated by the VA's core values of integrity, commitment, advocacy, respect, and excellence. All Northeast Ohio VA healthcare system nurse managers, assistant nurse managers, and nursing supervisors are eligible for this award.
Saskia Dean, manager of CT5, is an exceptional manager who provides the unit with professionalism and understanding in the managerial role. Saskia takes the role of manager very seriously and runs the unit well, giving instructions by personally making sure hall huddles were completed, educating each hall with NAs and nurses on how to complete and communicate during the huddles and her expectations, reminding staff of their bedside reporting, hourly rounding, power hour to reduce falls as we care for the veterans. She understands the workflow process of the VA. She keeps staff up to date with new policies and fire alarm and severe weather tornado drills, TMS, CPR, unit in services, and on and on. Saskia is compassionate in her work. She understands staff concerns, talks with staff to resolve conflicts by engaging staff to communicate with one another. She has an open door policy, is a great listener, and is inspiring to anyone who knows her. She recognizes her staff personally and through teams and emails. Saskia sets the example by continuing her education and prompts others to advance their career in nursing. She encourages staff members to join committees to better the unit and themselves. She cares for veterans, speaks to them on a one-to-one basis, educating and reminding them why they are at the VA and how we're working with them so they have a better life in the future. She interacts with veterans in the community area and demonstrates that being on CT5 dementia ward takes a special individual. She exhibits the Montessori values when working with staff and inpatient veterans. Saskia advocates for the unit consistently to ensure a well-balanced ratio of staff to veteran safety. Please join me in congratulating our Daisy Nurse Leader Award recipient, Saskia Dean.
The Sunshine Award. The Sunshine Award is a recognition program unique to VA Northeast Ohio healthcare system. It helps recognize our outstanding nursing assistants, surgical, and healthcare technicians who support VA nurses in caring for our nation's veterans. Nursing support staff are a vital part of the healthcare team. They partner with the RN and LPN to provide direct care for patients of all backgrounds. Patients and families often share stories about how these employees provide exceptional care and help create a safe, comfortable, healing environment. The Sunshine Award offers a way to recognize these individuals for the remarkable care they deliver. All VA Northeast Ohio healthcare system nursing assistants, surgical, and healthcare technicians are eligible for this award.
All right, for our Sunshine Award. Edward Queen is a nursing assistant in the MICU and CVICU and has worked in this department for many years. He is hardworking, dedicated, genuine, selfless, and sincere to veterans and nursing staff. Edward truly demonstrates the VA's IARE core values of commitment, advocacy, respect, and excellence every single day that he arrives at the VA to work. He takes pride in his position and care of the veterans. I know when he is here that the veterans will be safe, cared for, and in good hands. Edward truly believes in the VA's mission from the bottom of his heart and never asks for anything in return. Edward is always willing to go the extra mile and will stay to help veterans and coworkers. He always does what is best for the veterans and will ensure that they have whatever they need. He is a true advocate and always looks out for the RNs as well. Many times he has offered to share his meals with staff members when they brought nothing in to eat. I may have to come out and hang out with you, Edward. Edward takes pride in the quality and quantity of his work. He is thoughtful, concise, and will hold his own self accountable. For these reasons and many more, I would like to nominate Edward Queen, NA of the MICU CVICU, for the Sunshine Award because without him in MICU, we nurses couldn't grow. Please congratulate the Q2 Sunshine Award recipient, Edward Queen, healthcare technician.
Thank you, Mr. Schreier. It is now time for the Great Catch Awards. Patient safety reporting is important to improving patient care, decreasing adverse events, promoting awareness of possible adverse events, and becoming a high reliability organization. Great Catch Awards are a patient safety continuous improvement initiative to encourage staff to recognize and prevent adverse events. This quarter, we recognize employees who received the Great Catch Awards between January and March 2024. Please welcome Dolly Edmond from Patient Safety, who will present these awards.
Good morning. The first one is the January 2025 winner, and it is Ashley Warren, registered nurse 4B. A notable example of Ashley's excellence occurred in October 2024 when she treated a patient who developed Stevens-Johnson syndrome, a rare and feared complication. The patient developed a diffuse painful body rash, making it impossible to maintain IV lines or EKG lead stickers due to the skin sloughing. Ashley's quick recognition of the symptoms and prompt action were crucial in expediting the diagnosis and treatment process. Ashley's attentiveness to the patient clinical status facilitated a same-day skin biopsy and rapid transfer to a higher level of care, surpassing the average response time for such cases. Her hands-on care and efficient triaging of tasks were instrumental in managing this complex situation. Congratulations, Ashley. Our February winner is Roland Ravito, pharmacist. A veteran was ordered a medication administered through a nebulizer twice daily. The medication comes as an injectable solution, but administration through a nebulizer is an accepted off-label route. The order was entered requiring that nurses reconstitute the vial with 6 milliliters of normal saline at the bedside, then withdraw 3 milliliters and administer the medication via nebulizer. The injectable vial says that it can be stored for 7 days at room temperature or under refrigeration after reconstitution. However, when it's administered by inhalation, it should be reconstituted immediately before use to minimize the risk for pulmonary toxicity. So Roland noted that 3 vials had been dispensed to the patient. However, 6 doses had been given at that point, likely using the vial for 2 doses and unsure the beyond use dating, or if a 24-hour cutoff point was being observed. The IV room pharmacist discussed with pharmacy managers who previously approved bedside reconstitution. So moving forward, to minimize the risk of pulmonary toxicity, pharmacy will prepare the medication in the IV room immediately before use. Please congratulate Roland. For the March winner, it is Christy Marciando, Pinnacle Pharmacy. I hope I said that right. Okay. A veteran was hospitalized at an outside hospital for diabetic ketoacidosis. So empagliflozin, I hope I'm saying that right, was discontinued at that time per JLV records. An adverse drug reaction was entered into CPRS, the chart following a pharmacy appointment, and the prescription was discontinued. So the author alerted to consideration for SGLT2 to restart at the renal appointment. An addendum was placed with concern for the patient's history of diabetic ketoacidosis, yet a new prescription was placed by the primary team, and the adverse drug reaction note was removed from the chart with the comment that it was entered in error. So the author was alerted by the cardiovascular provider to issue a new SGL2 prescription as the patient was scheduled to see his provider in the clinic. The author recommended that the primary care physician to consider discontinuing the medication due to concern for the past diabetic ketoacidosis, as was noted in the adverse drug reaction notes. The prescription was discontinued at that time. Congratulations, Christy.
Thank you, Ms. Edmond. Our Employee of the Month Awards. VA Northeast Ohio Healthcare System strives to recognize individual employees who make contributions in support of the mission, organizational goals and objectives, and VA's strategic plan. This monthly award recognizes outstanding employee efforts during the specified period as evidenced by peers, customers, and management. The employees that are chosen for this award are nominated by other VA employees. A committee reviews the nominations and selects the awardee. The next awardees have received an Employee of the Month award between January and March 2024. Please welcome Ruth Hatchwell, Chair of the Employee of the Month Award Committee, who will speak to their nominations.
Our first nominee is for January 2025. David Bowen is a social worker in our community nursing home program under Home and Community-Based Care Services. David, along with other social workers and registered nurses within this area, complete monthly visits with our veterans that are under VA authorization at our 24 contracted nursing homes throughout Northeast Ohio for long-term care, inpatient hospice, and/or inpatient respite care. The visit entails completion of a national template to review the veteran's current condition, any weight loss, falls, etc. David is responsible for completing suicide risk assessments and advance directive discussions if warranted. I am nominating David for Employee of the Month for the coordination of transferring a veteran from one of our VA contracted nursing homes to another to support the veteran's wish of being closer to his family. Not only did David achieve his transfer successfully and assist with securing VA transportation, but he also noted that a pending VA travel consult for a VA follow-up appointment was entered with the veteran's previous facility. David reached out to the VA travel office to alert them of the new location and updated the address to ensure that this would not occur again. I'm proud of David for his catch and to minimize any break in care for our veteran. Please congratulate David Bowen, social worker. Our February award winner. On February 26, 2025, at approximately 8 a.m., Michael Snitzer, training specialist, noticed that Miss G walking towards the elevator. He noticed that something was off with her eyes, demeanor, and posture. Michael quickly determined that there could be a medical emergency and asked her if she was feeling okay. Based on her responsiveness and her apparent condition, Michael shouted loudly, "Hey, Chuck, grab me that wheelchair around the corner." Michael stayed with Miss G, holding her up as she was passing out and averting further injury by placing her in the chair. Michael asked if anyone was calling 911, and since no one was calling, he instructed the writer to call. Michael shared critical information to be relayed to the dispatcher. The instructions from 911 were to have a person remain with Miss G, make sure she did not eat or drink, and ask for someone to flag down EMS or fire. The quick action taken by Michael Snitzer prevented Miss G from falling and sustaining injury. Michael rendered aid, took command of the situation, and enlisted the help of others. Because of his clear mind and decisive decision-making, Michael was able to relay critical information to EMS and took efforts to stabilize her condition until EMS arrived. Michael Snitzer is worthy of the recognition of Employee of the Month. Please congratulate Michael Snitzer, Education Specialist, Employee Patient Experience Service. Our March 2025 award winner. A PAC nurse was looking for a patient with diabetic issues that hadn't been seen for a while. She came across a patient that had documentation in CPRS in 2023, where it stated that he did not want to reestablish or use the VA for any of his healthcare needs anymore. Unfortunately, he had a bad experience trying to schedule with Wade Park and was bounced around on the phones. Holly Sabo, AMSA, called him and asked him what happened, and initially he was still very angry and reiterated to her that he didn't want to come back to the VA and he would use his own private insurance. Holly spoke with him in such a compassionate manner and asked him to explain to her what had happened. After listening, she apologized for the mistake and asked him not to let one disappointment stop him from missing out from all the wonderful benefits that the VA had to offer. She took the time to listen to him, she acknowledged his disappointment, and turned him around. She was able to get him scheduled with her PAC team provider and he will be coming in for blood work the same day. Holly's commitment to the IARE values and customer recovery training she received from VA was instrumental in assisting this patient. She exemplifies these values daily with all her interactions with our veterans and fellow employees. Please congratulate Hollis Sabo, Advanced Medical Support Assistant. Congratulations to all our Employees of the Month awardees. Next, we will present our IARE Project Awards for Quarter 2 of 2025. The IARE Project Award recognizes projects which exemplify the IARE values of integrity, commitment, advocacy, respect, and excellence. These projects are not limited by topic or source. The project should demonstrate continuous improvement, patient satisfaction, and commitment to caring for our veterans. These projects can also highlight research and innovations in care. The actions being recognized should have occurred in the past 12 months. The IARE Project Award is presented for excellence. Strive for the highest quality and continuous improvement, be thoughtful and decisive in leadership, accountability for actions, willing to admit mistakes, and rigorous in correcting them. Our first IARE project goes out to a group caring for our veterans' end-of-life. Bridget Wassel and Susan Perez discovered a need for process improvement within the Community Living Center related to providing the end-of-life care. Through their work, they identified knowledge gaps and created a plan to provide a comprehensive and completed toolkit and resource binder for nurses to properly care for veterans at the end of life. With the support of the chief nurse, Kimberly Pyatt, their pair used their hospice expertise to develop a reference toolkit for nursing staff as they navigate the end-of-life care with their patients and their families, and to comply with relevant standard operating procedures. They provide printouts, instructions, pictures, booklets, packets, and several other important articles for the staff to have at their fingertips. The binder takes away the procedural stress and allows the nurses to focus on the most important priority, their veteran and their transition to death. This binder is currently approved and is in circulation at the Community Living Center. As there's much interest in the binder hospital-wide, it will be adopted in the acute care setting based on their patient needs. Bridget and Susan will together tailor the binders for those areas and the needs of those patients. Please congratulate hospice nurses, Bridget Wassel and Susan Perez. Our next group award, project award, goes to Diabetes Pathway of Care. PAC nurses voiced that they didn't feel clear on the role of the case manager, and it related to diabetes mellitus education. There were various models of care being implemented, resulting in decreased equity of their patients. Care was fragmented, and there was a lack of consistency and collaboration of our care in our clinics. Rachel Ice, Laurie Corbin, Julia Braylick, Marissa Longwell, and Natalie Ackman met with the assistant chief nurse and identified best practices. They established a goal to improve care by developing a tool nurses could follow. The team worked with interdisciplinary frontline staff to create clear, step-by-step guidelines to allow nurses to provide consistent, high-quality diabetes education to all patients in every clinic. The project team created a care framework for nurses to use. Educational and training resources were organized and available online, and CEUs were provided. Over 100 PAC nurses were trained in an evidence-based practice model for consistent diabetic care. Collaborative efforts were established to facilitate unified approaches from the hospital to the outpatient clinics. Please congratulate Rachel Ice, Natalie Ackerman, Julian Braylick, Marissa Longwell, and Laurie Corbin from the VA outpatient clinics. Our third project award goes to Counseling for Alcohol and Tobacco Use. Bradley Bennick, Janelle Bowden, Shireen Leftridge, and Heather Ertel worked with acute care nurse managers and assistant nurse managers to improve alcohol screening and counseling for patients admitted to psychiatry, acute care, and spinal cord injury units. Through data collection, it was discovered that VA Northeast Ohio healthcare system performed in the bottom quintile for 4 out of the last 5 fiscal years, significantly below the natural average. The team worked together to establish an improvement goal. Through their collaborative efforts, it was discovered that hard stops in the nursing admission notes, which would have advised admitting nurses on necessary elements, were lost because of the national mandate's VAAES note implementation. Additionally, clarification regarding the responsibility of the admitting nurse performing drug and tobacco use screening was required to support this improvement goal. To address the identified deficits, the team utilized evidence-based improved Lean Six Sigma methods. Employing the techniques, the team identified 3 areas deemed to be critical to quality education, deploying standardized work, and timely performance assessment. Their approach resulted in significant improvements in tobacco and alcohol cessation interventions. The percentage of veterans screened and counseled for tobacco increased from 56 to 83%, and from 11 to 85% for alcohol. These results have been sustained for the past 6 months. In addition to exceeding the performance goal, our facility is one of the top performing healthcare systems in the VA enterprise. Please congratulate Brad Bennick, Nursing Operations, Janelle Bowden, Nursing PCMH, Shireen Liftridge from Nursing, and Heather Ertel from Quality.
We will now present the HERO Awards for Quarter 2, 2025. The National HERO Award recognizes staff members who advance VHA's journey to high reliability by demonstrating VHA's high reliability organization principles in action. These may include going above and beyond in patient care or workplace safety, making a change in the process or procedure that positively impacts patient care or workplace safety, serving as a role model or peer champion of HRO, or leveraging safety practices to perform well in a crisis or emergency situation. Nominations can be submitted in 4 categories: clinical individual, non-clinical individual, clinical team, and non-clinical team. Any individual can submit a nomination to recognize a group or an individual. Nominations are accepted on a running basis, but are reviewed quarterly on the VA Northeast Ohio healthcare system level, and awardees in 4 categories are selected. These selections are further nominated to the VISN-10 level of Hero Award, and if selected by VISN-10, are then submitted as nominees for the National Hero Award. Please welcome Ms. Marina Vizkoon to read these nominations and present these awards.
So we will start with the Hero Award in the clinical team category, and it goes for the urology prostate cancer team. Prostate cancer is the most common malignancy among veterans, with over 1.2 million patients diagnosed and or treated since 2000. To standardize care processes, the Urology Cancer Care Coordination Team created a Teams channel with the pathology department. Every prostate cancer patient is screened for personal and family history, their pathology, and an email is sent in real time alerting the provider. Care coordinator tag themselves on all pathologies to ensure nothing gets missed. And a general alert of a bladder cancer was received one day. A nurse noticed the diagnosis was different from the past and checked with the reporting pathologist whether this was a new diagnosis. Within minutes, a new CPRS alert was received with updated and revised pathology and explained as a transcription error. The pathologist thanked the nurse for catching the mistake, and veteran had a follow-up for pathology review. Before, only a few patients were offered genetic testing at the time of their office visit. During calendar year 2024, 194 patient records were reviewed, with 60% of those in high, very high, metastatic, and or significant family history category, an increase of 18% since 2022, receiving genetic consult. The Northeast Ohio Healthcare System Urology Cancer Care Coordination Team practiced preoccupation with failure and reluctance to simplify by identifying a gap in the care process. Being sensitive to operations, they provide clear communication through real-time alerts to the providers and offer individualized precision oncologic care at a higher level and higher rate than most civilian academic hospitals. Congratulations to the Urology Cancer Care Coordination Team for not only being the VA Northeast Ohio Healthcare System Hero Award winners, but also Clinical Team Category Heroes regionally with VISN-10 and nominees for the National Hero Award. Please congratulate these team representatives. There's more, but they are representatives today. Pamela Hughes, LPN, Allison Chadha, RN, BSN, and Teresa Nedelkovic, RN, BSN. And now we will talk about the Hero Award nomination and winners in non-clinical team category, and it goes to the SCI Patient Travel Team. In September 2024, at the end of the fiscal year, when funds are extremely low, a 100 spinal cord quadriplegic veteran was ready for discharge to reunite with her military spouse in Texas by traveling a commercial flight the next day. SCI clinical team raised the concern that one of her wounds had reopened, and due to her general condition, a commercial flight might be a safety concern. This meant an extremely quick overnight turnaround and escalated costs of $36,000 when only $17,000 were left in the travel budget. The Northeast Ohio Healthcare System Mobility, Travel, Patient Advocate, and Budget teams sprang into action. Tracy Price, Travel Program Support Assistant, elevated the request to Mobility Manager Tanisha Reese, who guided the SCI team through the situation, and she collaborated with Fiscal to ensure availability of funds. Concurrently, Tracy was working with multiple medical flight vendors to determine availability and cost in conjunction with maintaining normal operations at the medical center. The veteran's family, however, saw none of this behind the scenes because of patient advocates Juliet Ratti and liaison David Drew's support. The next day, the veteran traveled safely by medical air transportation and reunited with her husband. Sensitivity to operations, preoccupation with failure, and deference to expertise were engaged. Each step that could lead to failure was addressed. Staff remained focused on multiple targets at once, and each area provided the expertise and worked in concert to provide the best care possible. These heroes in the non-clinical team category are both VA Northeast Ohio and Vision 10 award winners and are nominated for the National Hero Award. Congratulations. And the team in front of you are Tracy Price, Heather Mariner, and David Drews. Now we will celebrate clinical individual category, LST note, and interventional radiology. In interventional radiology, Sarah M. Richard, BSN RN, was preparing the patient and the room for routine procedure. The veteran's last LST note declared him a DNR. However, veteran denied that. Immediately, the procedure was paused while the documentation was completed. Following the event, RN Richard questioned the lack of update to the LST note and LST orders during procedures as part of the standard step when communicating with patients. Sarah reached out to ethics subject matter expert and interventional radiology nursing leadership who offered training and education to follow ethical and medical center policy. The LST note and order set is now being utilized appropriately and in accordance with all policies. Sarah M. Richard, BSNRN, engaged all HRO principals. She was preoccupied with failure when she discovered the DNR LST note was incorrect, which prevented potential sentinel event. She was reluctant to simplify and investigated the root causes of why the team found itself in this situation. Being sensitive to operations, Sarah requested change to the care processes, deferring to the expertise of the ethics team who guided on how to proceed forward. She was committed to resilience and made sure her IR team was as well. Sarah Richards' hero behaviors impacted one veteran's safety and prevented potential adverse safety events for other patients. Congratulations on being our hero in the clinical individual category. And last but not least, the last category is non-clinical individual category and goes for the ESTAT program. Less than 1% of VHA employees have access to statistical software, which is critical in VHA's journey in becoming an HRO. Currently, to perform statistical analysis, each employee must obtain a $1,600 license. To overcome this need, an investment of approximately $53.6 million in licensing fees, conservatively assuming that 10% of VHA staff need the statistical software to improve care delivery, VA Northeast Ohio Healthcare System Quality Management Analyst Sebastian Godby single-handedly developed ESTAT, a no-cost Microsoft Excel-based statistical tool that can immediately be adopted nationally by the VHA. Its use empowers employees to perform statistical analysis from basic to advanced levels, improves how employees do their work and deliver care, and teaches, mentors, and guides them in performing analysis and hypothesis testing. ESTAT also contains narrated video tutorials about creating plots, charts, tests, regressions, and many others. To date, the ESTAT has gone through numerous iterations and had already been diffused to hundreds of VHA employees. Care management analyst Sebastian Godby's sensitivity to operation is evident, and his focus on the needs of employees, his preoccupation with failure led him to preemptively develop the necessary tools, and his reluctance to simplify not only saves $50+ million in cost of statistical software, but also offers VHA employees visual education and assistance with statistical analysis. Congratulations to Sebastian Godby on being the Hero Award winner in the Non-Clinical Individual category.
In closing, I would like to first of all say congratulations to all of our amazing awardees and thank you to those of you who have come to support them. I'd also like to thank Timothy Hyman for being our executive leader today and Catherine for being our lady, I'm saying MC, but that's usually male, mistress of ceremonies. How about that? Okay. Any awardees who did not come to the ceremony today will receive their awards within the next couple of weeks. They will be either delivered to your chiefs or AOs and sent to the C box to be distributed to the awardees. I'd like to invite all of you to go to the back of the hallway and to enjoy the refreshments that have been provided for us. And I thank you all for being here today and congratulations again.